What's really causing your patients tight hamstrings in up to 76% of patients? Find out in this new study by Pesesse et al. 2025. They assessed 178 asymptomatic adults to identify if the discomfort that was limiting their hamstring range of movement was muscular or neural. They split them into two groups. Number one, they performed the straight leg raise. And number two, they tested the knee extension angle. That's where they took them into 90 degrees hip flexion, then passively extended the knee. Then the patient said stop when they felt any discomfort in the leg. And then while they maintained that position of the leg, they then passively flexed the thoracic spine and the cervical spine until they got full range of movement, and that's with strong resistance. And then they asked if the symptoms increased, decreased, or were the same. They then passively extended the thoracic spine and cervical spine using that movable part of the table and asked if their symptoms changed. And then if it increased with thoracic spine and cervical spine flexion and decreased with extension, that's really only changing joints that are pretty far away from the leg. They considered it neural in origin. If there was no change, then it was muscular. So what did they find? The resistance was neural in 72 to 76% of people. So what's the clinical takeaways? Well, if you're assessing your patient's hamstrings with a knee extension angle or a straight leg raise, you can use movement of the thoracic spine and the cervical spine to identify if it's actually muscular or neural in origin.